The small T-shaped plastic device commonly used to prevent pregnancy may also have another surprising benefit: reducing cervical cancer. New research published in the Obstetrics and Gynecology Journal suggests that the placement of an intrauterine device, also known as an IUD, could stimulate a life-saving immune response in a woman's body by cutting the chance of getting cervical cancer by as much as a third.
We know that women who use an intrauterine device will have an inflammatory response, which is an immune process, and we suspect that that inflammatory response may somehow help prevent cervical cancer.
The researchers looked at data from 16 high-quality previously published studies that examined the role of IUDs in developing cervical cancer.
The group of women who had used an IUD appeared to be at lower risk, so less frequently had developed cervical cancer than women who had not used an IUD.
Medical experts say a virus commonly known as HPV plays a substantial role in causing cervical cancer because it destroys healthy cells. The infected cells then divide and can spread the virus elsewhere. Cortese says that about 90% of women who are infected with HPV have an immune response that clears the virus. But for the other 10% of women, the persistent infection of HPV could be fatal.
What we anticipate in this hypothesis is that either a woman who already has a persistent infection and has a device placed, has an immune response to the procedure, the tissue that harbors the infection overlies tissue that needs to be manipulated to place the device.
After analyzing quantitative data, Cortese says it's extraordinarily unlikely that this is a chance discovery. That could be good news for the more than 500,000 women who are diagnosed with cervical cancer each year, according to the World Health Organization. The new research is still limited in scope since the type of IUD isn't known. Cortese says non-hormonal IUDs were likely examined in the previous studies, but isn't 100% sure. Questions aside, Cortese says IUDs could help a generation of women who weren't able to receive the vaccine that wards off HPV.
We're looking at 30, 40, 50 years of women remaining at risk because they couldn't be vaccinated.
And while IUDs may never become the primary way of preventing cervical cancer, they could help promote overall better public health.
The most comprehensive study that's been done to date established that fewer than 2% of girls in the developing world who qualify to receive that HPV vaccine have yet had it. So we don't know when there will be enough women vaccinated in the developing world that the vaccine is going to have an impact, but we know it's decades from now.